Every single morning, millions of people step onto the scale, see a number they don't like, and immediately blame themselves. They look down at their midsection, pinch the flesh around their waist, and think one word: fat. But here's what nobody is telling you. In the overwhelming majority of cases, what you're seeing in the mirror, what's stretching your waistband, what's making your clothes tighter every month, that isn't fat at all. It's fluid, it's inflammation, and it's something your body is desperately trying to show you, but you've been taught to ignore it. I'm going to be very direct with you right now. The healthcare system does not make money when you understand the difference between adipose tissue and interstitial edema. There is no billing code for teaching you how your lymphatic system works. Your next doctor's appointment will not include an explanation of why your belly is holding 3 to 5 liters of excess fluid that has nothing to do with calories. Subscribe to Dr. Waterling right now and hit that like button. We're working toward building this channel on one principle: giving you the information that actually matters, the information that the system will never prioritize, because there's no profit in you solving this at home. Look at your abdomen right now, not later. Right now. Press your thumb into the skin just above your hip bone and hold it there for 3 seconds. When you release, does the indentation stay visible for more than 2 seconds? If it does, that's called pitting edema. That is not fat. Fat doesn't hold the shape of your thumb. Fluid does. In 15 years of clinical practice, I have watched people lose inches from their waist in 72 hours without losing a single pound of actual adipose tissue. They drained fluid, they reduced inflammation, and their entire body composition changed. Here's the truth that nobody wants you to understand. After the age of 40, the human body begins to lose efficiency in a specific system that most people don't even know exists. It's called the lymphatic system, and it is responsible for draining excess fluid, cellular waste, and inflammatory proteins from your tissues. When it slows down, and it does slow down with age, your body becomes a reservoir. Fluid that should be moving, circulating, and exiting through your kidneys instead pools in your abdomen, your thighs, your lower back, and your face. You wake up puffy. Your rings don't fit by evening. Your stomach looks flat in the morning and distended by 8 p.m. And you've been told this is weight gain. Let me explain exactly what's happening inside your body. Your cardiovascular system, your heart and blood vessels, moves blood through arteries to deliver oxygen and nutrients to every cell. At the capillary level, the smallest blood vessels, fluid is pushed out of the bloodstream into the surrounding tissue. This is normal. This is how nutrients reach cells that aren't directly touching a blood vessel. But here's the critical part. That fluid has to come back. Some of it re-enters the bloodstream through the veins, but approximately 3 liters per day, that's roughly 12 cups, enters the lymphatic system instead. The lymphatic system is a parallel network of vessels that runs throughout your entire body. Think of it as a drainage system, a one-way highway designed to collect excess tissue fluid, filter it through lymph nodes that remove bacteria and damaged cells, and return it to your bloodstream near your heart. When this system is working properly, you don't notice it, you don't feel it, you certainly don't see it. But when it slows down, when lymphatic flow decreases even by 20 or 30%, you begin accumulating fluid in your tissues. And the first place most people notice this accumulation is the abdomen. Why the abdomen specifically? Because of gravity and anatomy. You have clusters of lymph nodes in your groin, your armpits, and your neck. These are filtration stations. The abdominal cavity sits above the inguinal lymph nodes in your groin, which means fluid traveling upward from your legs has to pass through a congested area. When those nodes become sluggish, when lymphatic vessels lose their pumping efficiency, fluid backs up. It pools in your lower abdomen first, then gradually spreads upward and outward. You interpret this as belly fat. Your doctor might even tell you to eat less and move more, but you could eat 1,200 calories a day and exercise 6 days a week. And if your lymphatic system isn't draining, that fluid will stay exactly where it is. Now here's where this gets critical. Lymphatic congestion doesn't just create a cosmetic problem, it creates a metabolic disaster. When fluid accumulates in your abdominal tissues, it increases the distance between your blood vessels and your cells. Nutrients can't reach cells efficiently. Waste products can't be removed. removed. Inflammatory proteins that should be cleared away instead sit in your tissue, creating localized inflammation. This inflammation signals your body to send more immune cells to the area, which creates more fluid accumulation, which creates more inflammation. You are now in a self-perpetuating cycle. And here's what absolutely nobody is telling you. Chronic lymphatic congestion in your abdomen directly interferes with insulin sensitivity. When your abdominal tissues are inflamed and waterlogged, your cells become resistant to insulin signal. Your pancreas has to produce more insulin to achieve the same glucose uptake. Higher insulin levels tell your body to store fat rather than burn it. So now you actually are accumulating adipose tissue, but it's happening because of the fluid problem that nobody diagnosed in the first place. Let me give you a concrete example. I had a patient, Margaret, 58 years old, who came to my office convinced she had gained 30 pounds in 6 months. She brought her food diary. She was eating approximately 1,400 calories per day, walking 45 minutes every morning, and her weight kept climbing. She was desperate. She thought her metabolism had completely shut down. I examined her abdomen and immediately saw the signs. Diffuse swelling across the lower belly, pitting edema when I pressed above her hip bones, and visible distension that got worse as the day progressed. I explained to Margaret that she hadn't gained 30 pounds of fat. She had accumulated fluid. We did a simple body composition analysis that measured total body water. Her interstitial fluid, the fluid outside her cells, was elevated by approximately 4 liters. That's nearly 9 pounds of pure water sitting in her tissues, doing nothing but creating inflammation and making her feel like a failure. We implemented a lymphatic drainage protocol. No calorie restriction. No intense exercise, just specific movements and dietary modifications designed to restore lymphatic flow. Within 3 weeks, Margaret had lost 7 inches from her waist. Her weight dropped by 11 pounds. And here's the remarkable part. Her energy improved, her joint pain decreased, and her fasting blood glucose normalized. That is not a weight loss story. That is a fluid drainage story. And it's happening to millions of people who have no idea what they're actually dealing with. So what should you do instead? I'm going to walk you through a complete clinically organized protocol that addresses lymphatic drainage, reduces inflammatory fluid accumulation, and restores your body's natural ability to regulate tissue hydration. This is not about starvation. This is not about supplements. This is about understanding physiology and working with your body instead of against it. First, we address fluid intake timing. This sounds counterintuitive because you've been told to drink 8 glasses of water a day, spread evenly throughout the day. That advice is creating the problem. When you drink large amounts of fluid continuously, you overwhelm your kidney's ability to process it efficiently. Excess fluid enters your tissues faster than your lymphatic system can drain it. Instead, you need to front-load your hydration. Drink 500 to 700 milliliters. That's approximately 2 to 3 cups within the first hour of waking. Your kidneys are most efficient in the morning after overnight rest. They can process this fluid load and eliminate it before it has a chance to pool in your tissues. Then, limit fluid intake to small amounts, 100 to 150 milliliters per hour, throughout the rest of the day. This maintains hydration without overwhelming your drainage capacity. Second, you need to activate lymphatic pumping through specific movement. The lymphatic system doesn't have a heart. It relies on muscle contraction and one-way valves to move fluid upward against gravity. When you sit for extended periods, when you cross your legs, when you wear tight clothing around your waist, you compress lymphatic vessels and stop flow. The single most effective movement for abdominal lymphatic drainage is what I call the pelvic tilt pump. Lie on your back with your knees bent and feet flat on the floor. Place your hands on your lower abdomen. Inhale deeply through your nose, allowing your belly to rise and push against your hands. As you exhale slowly through your mouth, tilt your pelvis upward, flattening your lower back against the floor while gently drawing your navel toward your spine. Hold this position for 3 seconds. You should feel your abdominal muscles engage. Release and repeat. Do this 20 times. Twice per day, once upon waking and once before bed. This movement creates rhythmic pressure changes in your abdominal cavity that physically push lymphatic fluid toward your thoracic duct, the main drainage channel that returns lymph to your bloodstream. Third, you must eliminate foods that promote fluid retention through inflammatory mechanisms. I'm not talking about sodium, although excessive sodium does matter. I'm talking about foods that trigger histamine release and increase vascular permeability. When your blood vessels become more permeable, more fluid leaks into your tissues. The worst offenders are processed wheat products, particularly those containing gluten and amylase trypsin inhibitors that trigger low-grade intestinal inflammation, aged cheeses that are high in histamine and tyramine, alcohol which directly increases vascular permeability and inhibits antidiuretic hormone, and high-sugar foods that spike insulin and promote sodium retention by your kidneys. Replace these with foods that actively support lymphatic function. Cucumber contains silica and sulfur compounds that strengthen lymphatic vessel walls. Celery provides natural coumarins that have mild diuretic effects without depleting potassium. Leafy greens like parsley and cilantro are rich in chlorophyll, which supports liver detoxification, reducing the toxic load your lymphatic system has to clear. And here's one that surprises people: raw beets. Beets contain betaine and betalains that improve bile flow. Better bile flow means better fat digestion, which means less lymphatic congestion from poorly digested fats entering your lymphatic vessels through your intestinal lacteals. Let me give you a specific daily protocol that combines all of these elements into an implementable schedule. This is what I gave Margaret, and this is what I've used with hundreds of patients experiencing abdominal fluid retention. Morning, 6 to 7 a.m. Before you get out of bed, perform the pelvic tilt pump exercise 20 repetitions. This activates your lymphatic system before gravity works against you. Stand up slowly, and within 15 minutes of waking, drink 500 milliliters of room temperature water with the juice of half a lemon. The citric acid supports liver function and the volume stimulates kidney filtration. Wait 30 minutes, then eat breakfast. Your breakfast should include protein to stabilize blood sugar and prevent insulin spikes that promote fluid retention. 2 eggs cooked any style, 1 cup of sautéed spinach or kale, and 1/4 of an avocado. This combination provides protein, potassium, which balances sodium, and healthy fats that don't burden your lymphatic system. Mid-morning, 10 a.m., prepare what I call lymphatic flush tea. Take 1 cucumber, peeled and chopped, 4 stalks of celery, 1 handful of fresh parsley, and the juice of 1 lemon. Blend with 200 milliliters of water until smooth. Strain if desired. Drink this slowly over 20 minutes. The combination of natural diuretics and lymphatic supportive compounds creates measurable reduction in tissue fluid within 2 to 3 hours. Afternoon, 1 to 2 p.m. Lunch should be light and anti-inflammatory. Grilled chicken breast or wild-caught fish, approximately 150 grams, over a large salad of mixed greens, grated raw beets, shredded carrots, and fresh herbs. Dress with olive oil and apple cider vinegar, 1 tablespoon of each. The vinegar improves stomach acid production, which enhances protein digestion and reduces the inflammatory byproducts that burden lymphatic clearance. After lunch, 3 p.m., perform 10 minutes of what I call lymphatic walking. This is not power walking. This is deliberate, purposeful movement designed specifically to pump lymphatic fluid. Walk at a moderate pace, but every 30 seconds, rise up onto your toes for 3 steps, then return to normal walking. This action activates your calf muscles, which function as a secondary heart for your lymphatic system, pumping fluid upward from your legs and reducing the backup into your abdomen. Evening, 6 to 7 p.m. Dinner is your smallest meal. Your lymphatic system slows down in the evening, and large meals create digestive stress that produces inflammatory waste products. Eat steamed or roasted vegetables, approximately 2 cups total, focusing on asparagus, which has natural diuretic properties, and a palm-sized portion of protein. Finish eating at least 3 hours before bed. Before bed, 9 to 10 p.m. Perform the pelvic tilt pump exercise again. 10, 20 repetitions. Then, lie on your back with your legs elevated against a wall for 10 minutes. This position reverses the gravitational pooling of fluid in your lower body and allows your lymphatic system to drain accumulated fluid while you're at rest. You should feel a sense of lightness in your legs and abdomen after this practice. Now let me address the timeline for results because this matters for your expectations and your commitment. Within the first 48 hours, you will notice reduced morning puffiness in your face and hands. This is the most immediate indicator that lymphatic drainage is improving. Within 5 to 7 days, you will see measurable reduction in abdominal circumference, typically 1 to 3 inches, depending on your starting level of fluid retention. Within 2 to 3 weeks, your clothes will fit differently. Your rings will feel looser, and you will notice improved energy because your cells are finally receiving nutrients efficiently without the barrier of excess interstitial fluid. But here's what I need you to understand. This is not a temporary fix. This is a physiological correction. If you return to the habits that created lymphatic congestion in the first place, sitting for 8 hours without movement, eating inflammatory foods, drinking fluids erratically throughout the day, the fluid will come back. Your body is not broken. Your lymphatic system is not diseased. It's just overwhelmed by lifestyle factors that modern medicine never bothers to address. The system you rely on for health guidance is not built to teach you about lymphatic function. There's no pharmaceutical intervention for sluggish lymph flow. There's no surgery to unclog lymphatic vessels. There's no expensive test to diagnose interstitial edema unless it's severe enough to be classified as lymphedema, which is a completely different clinical entity. So you will never hear this information in a standard office visit. You'll be told to lose weight, eat less, move more, maybe get prescribed a diuretic that will dehydrate you without addressing the underlying lymphatic dysfunction. If you have abdominal swelling that is accompanied by severe pain, fever, or sudden onset within hours rather than weeks or months, that is not lymphatic congestion. That could be acute pancreatitis, appendicitis, or bowel obstruction. See a physician immediately. If you have swelling in only one leg, particularly with redness, warmth, or pain in the calf, that could indicate deep vein thrombosis, a blood clot. That requires emergency evaluation. What I'm describing today applies to chronic, diffuse, bilateral fluid retention that has developed gradually over months or years and gets worse as the day progresses. If you are currently taking medication for high blood pressure, heart failure, or kidney disease, do not modify your fluid intake or start diuretic foods without discussing it with your prescribing physician. These protocols support normal physiology. They do not replace medical management of diagnosed conditions. How old are you? Write it in the comments. I want to see which age group makes up the majority of our viewers because lymphatic efficiency changes dramatically at different life stages, and your feedback will shape what I cover in future videos. If this video helped you understand something your doctor never explained, send it to someone you care about. A parent, a friend, a partner who's been struggling with unexplained weight gain and feeling like they're failing when they're actually dealing with a physiological drainage problem they didn't know existed. You may have just given them real hope. You are not helpless in front of your own biology. Your body is not betraying you. What you're seeing in the mirror is a signal, not a verdict. And now you know exactly what that signal means and how to respond to it.